Here, I present to you the best teaching that you can possibly get. Why? Because I'm going to combine the five senses of human being into teaching. So, here is an epileptic patient. Do you see that epileptic patient? He's seizing. Do you see him? Yes, I think that you see him. He had an episode of seizure. He presented to ER with arm adduction and internal rotation. What do you expect him to have? So, this question is asking you a type of dislocation, orthopedic kind of question, but I want to teach you how to learn with the five senses, okay? So, now I think that you can see a patient or imagine a patient who is having his arm adducted. Do you see him? I think you're imagining that person, right? The uh, the arm is adducted. It is really close to the body, and it is internally rotated, which means it's facing toward the body. So now you saw the patient, right? You saw the image, right? Can you smell that? Smell? Yes, you can smell the blood. You can smell that kind of fracture. Okay. Can you taste it? I don't think that it's gonna be good. That's gonna be disgusting, right? Because if you taste it, it's gonna be bloody. Okay. What about hearing? Can you hear that kind of dislocation? Oh! So he has a dislocation of his arm, and now his arm is adducted and internally rotated. Okay, so his arm is adducted and internally rotated. So you can see it, right? You can see it with your naked eyes. The last thing is that you can touch it. You can touch the arm, you can examine the patient, and he's going to be really in a bad shape because he's going to have pain, right? He's going to have pain, and you can touch that patient. So what kind of dislocation the patient has? I think that the patient has posterior dislocation. So why did I say that? Because I just memorized it. Posterior dislocation is that position when you see the arm in its inducted and internally rotated state, you say that the patient has posterior dislocation. You're done. That is the most important thing, okay? So, if the patient has the opposite, it's going to be anterior dislocation. So you just memorize posterior dislocation. If you see another picture, like the arm is abducted away or externally rotated, then you know that it is not a posterior dislocation. It must be anterior, right? Thank you so much for listening for this teaching video.